My PowerPoint is arrhythmia, one big puzzle. I chose to do arrhythmia because I've been working in EP for about 10 years, so it's kind of my passion. So here we go. I'm going to just talk a little bit about the conduction system, the SA node, the AV node. I'm going to explain to you the difference between sinus rhythm and atrial rhythm, the cause and effect, and the possible cures of arrhythmia. First, before we get started, I'm just going to talk quickly about the conduction system. This basically tells you how the heart pumps, or how it contracts, better yet. So the heart has a conduction system separate from any other system. The conduction system makes up the PQRST, which is the heartbeat that you see on the EKGs. Any arrhythmias is a disruption in the conduction system. So basically, it throws a fork in the beat of your heart. So when your heart can't squeeze, the blood can't flow, therefore it causes an arrhythmia. And here's just going to be a little video about the conduction system.
The heart is a muscular organ. Before the two nerve chambers.
Okay, so what it just talked about was the SA node and the AV node. The SA node is the primary pacemaker of the heart. It initiates every normal beat that you're going to hear in your heart. So when you hear that heartbeat and it's completely normal, you know that's coming from the SA node. The beats usually run from 60 to 100 beats per minute. These represent the P wave on your QRS, again, which you're seeing on your EKG. And then the AV node is what we call the septum of the heart, and it represents the PR segment of the QRS, again, on the EKG. It has a little bit lower of a rate, from 40 to 60 beats per minute, and it acts as a backup for the SA node. But you'll always know that it's coming from the AV node if there is a junctional rhythm, aka an arrhythmia, coming from the heart. Okay, this is what a normal sinus rhythm looks like on an EKG, and I'm also going to show you what it looks like when you're actually watching it. You'll notice it's going to be just a nice steady beat. Everything's nice and even. So that is your normal sinus rhythm. So this is sinus arrhythmia. As you'll see, you can see that it's not all the exact same. Some takes a little bit longer to beat, and some will go very quick like. So obviously this rhythm is irregular, but it's still in sinus rhythm. So you can have arrhythmias in sinus, and you can have arrhythmias in the atrial. So we'll talk about that as well. But the sinus arrhythmias are not life-threatening. And again, here I'm going to show you just what it looks like on an EKG and what to look for. As you'll see, it's skipping some beats and then doing a few double beats as well. So that's what that looks like. So now we're going to talk about atrial rhythms, which is a wandering pacemaker, meaning it's going to be irregular. The rhythms are always irregular. The rate depends on an underlying rhythm. The underlying rhythm must be identified before you can even identify if it's an atrial rhythm or not. The few types I'll talk about is atrial fibrillation, atrial flutter, and atrial tachycardia. Atrial fibrillation, also known as AFib, is basically there's no organized electrical activity in the atria, meaning the top part of the heart and the bottom part of the heart are not controlled, and they're going against each other. This is an electrical issue, as we call electrophysiology. It's an electrical issue, so therefore, like I said, the top and the bottom part of your heart are not in sync. Therefore, it causes your heart to fibrillate. Atrial flutter is an atrial rhythm that is what we call regular, and the ventricular rhythm is irregular. The rate will depend on the ratio or impulse conducted through the ventricles. You'll notice a difference on AFib. You'll see spikes on the EKG, and flutter, you'll see it just flowing, looks like a bunch of little mountains, as we call it at work. And again, your pulse will not be as high with atrial flutter as it is with AFib. The causes and effects. So they all arise from the atrial myocardium, and they share common etiologies. The causes sometimes can be hypertension, congestive heart failure, sick sinus syndrome, cardiac stress. They can come from a heart attack. So there's multiple reasons why you get arrhythmias. In AFib, we're going to talk about. Okay, so we're going to talk about the manifestations. So basically, what could happen if you had AFib? You may develop an embolism in the left atrial. You have a very high risk when you let AFib go untreated of having a stroke. Therefore, the best thing to do is obviously go to the doctor, get it looked at, and immediately get on a blood thinner, Coumadin, Pradaxa, whatever you decide on that fact. But with AFib, again, like I said earlier, your heart is not getting a good squeeze, therefore it's causing the blood to overpool. And when that happens, that's when blood clots happen. So we want to keep the blood nice and thin so it can flow through the veins. Any therapy for AFib, you can get an ablation, which is one of the newer things to do. But like I said, the first thing to do is get on some kind of blood thinner. Warfarin, it has aspirin on here as well. We want to restore sinus rhythm, which could be a cardioversion. Some people choose to do it just with medication. There's medications, sotalol, amiodarone, things like that. So you have a few options there. The symptoms of any arrhythmia, really, the first symptom is chest discomfort. A lot of people think they're having a heart attack, but really it's just your heart skipping too many beats or beating too much. You get the arm and back discomfort, again, like a heart attack symptom. Your neck and jaw hurt. You a lot of times feel lightheaded, break into a cold sweat. A lot of people have syncopal episodes, and you'll also have a lot of shortness of breath. Again, because during AFib, let's say your heart's beating 120 beats per minute, your body on the internal is like you're running a marathon. So you need to go ahead and get that looked at if something like that is going on. Okay, so the possible cures and treatment. is antiarrhythmic drugs, like I just talked about, amiodarone, sotalol, or an RF ablation. Basically, with the ablation, it's somewhat like we would know about a heart cath, but instead of the wand that they use to inject the dye, that there's actually a little wand that looks like a torch, and that's going to burn away the tissues that are blocking the electrical current from getting from the top part of your heart to the bottom. So it's actually really cool. It takes about 3 to 5 hours. The procedure does, but it actually is a curing procedure if it works, of course. Some people choose to get a cardioversion. Most times that's a quick fix, but basically that's the 2 paddles they stick on you, and they cardiovert your heart back into sinus rhythm. And the AICD also is like a little cardioversion implanted into your right under the muscle, and that's going to give you a shock if your heart goes out of rhythm. Again, preventative method, not a cure. And then a pacemaker for those are more for a bradycardic issue, but AFib and a flutter, some doctors choose to put in a pacemaker for those reasons as well. And that's it. So I just put my sources down, and in conclusion, I just want to make everybody aware that, if you do have AFib, there is a cure, and a lot of people don't go for an ablation because they get scared, but honestly, working with it, I've seen millions and millions of people cured from the disease, and it's not an easy one to live with. It makes you very, very tired, and so I just hope by doing this, maybe I've taught somebody something. Thank you.